Okay, so Amy, what would you say to other First Nations women who might be a little bit afraid or unsure about getting screened for cancer?
I think I would say that I can understand why you feel that way, but your health matters and your health is important. And it's important to find places where you feel welcomed and accepted so that you can go through the screening and the treatment processes and feel valued and accepted throughout that process.
Wow. And can you speak the importance of getting regular checkups and screens in preventing and detecting cancer early?
Yeah, so it is intimidating to go in and be so vulnerable, but it is important because early detection is key. It will give you so much more chance to have a better outcome, which is very important for MOB, as we often don't get screened and we often have bad health outcomes. So it's important to go and get screened, whether that be a mammogram or a cervical screening.
Okay, so Amy, what requests can First Nations women make when going through their healthcare journey?
I think it's really important to request that you have someone with you, whether that be a family member or requesting an Aboriginal liaison officer through the hospital or wherever you're receiving your care, because it is important that you have someone there that understands your point of view and your worldviews surrounding the issues at hand, and you have them to speak up for you when you're dealing with things that are very hard to deal with and you might not be in the right state of mind to take that information on. So having someone with you is really helpful in those situations, as well as requesting a female practitioner for women's business things, so cervical cancer and breast cancer related concerns. You do have the right to request a female practitioner. You do have the right to be modest and cover up when you're undergoing those screening services, and just ensure that you're taking care of your cultural identity throughout the process, because it is very vulnerable and it does go against some cultural norms. So just try and preserve that throughout the process.
Okay, so I did also want to address, how do you think you could go about raising awareness within First Nations communities when talking about cancer prevention?
It's really important to start the conversation with MOB, whether that be other women in your family or just in the wider community. That's the best way to raise awareness and to get the conversation started. Younger women may not know about what's out there or when to start getting screened.
Okay, Amy, so to conclude this video today, I just wanted to ask, what advice would you give to First Nations women who just received a cancer diagnosis to seek support?
The biggest method of support is our MOB. So a big cultural value of ours is kinship and talking to family, having a yarn, getting that support from your family. But there is also support groups outside of family that are tailored for First Nations women. So find your local support group. They may be cancer specific or chronic disease specific, but go in, have a yarn, get that support that you need, because it is a major life-changing diagnosis. So as long as you're supported through that,